Yeah.
Hi, I'm Dr. Mary Evangel from Vasan Eye Care, Trichy. Today, Dr. Shibu Varki and me will be discussing the various facilities available at Vasan Eye Care, Trichy. I hope this interactive session will be useful to all of you. Nowadays, many young patients are having a social problem with wearing glasses. Especially the young girls before marriage are very hesitant to wear glasses. What is your experience?
Myopia or wearing minus power glasses, it can be corrected, as it's now very well known, using the LASIK laser, which is a very simple procedure where using a laser beam we can just remove the power from the patient's eye so that the patient can then see normally and do all the activities without the use of glasses. The procedure is a very simple procedure, very short procedure, and a procedure with a high level of success and stability for long term. The only thing is that we should select the correct patients, because LASIK laser cannot be done for everybody. The most important thing is the corneal thickness. If the corneal thickness is good, then the LASIK laser can have a high success rate for these people. People who do not have sufficient corneal thickness or sufficient thickness in the cornea, for them there are other options. The most commonly done is called as the implantable collamer lens, or ICL. ICL or phakic IOL. These are the various terms which are there. ICL, phakic IOL. So this surgery helps people with minus or plus power or whatever glass power, but who are not fit for laser correction. They can have this ICL procedure done.
Nowadays, there's a big talk about bladeless LASIK, femtosecond LASIK.
Yes.
Can you tell us?
Femtosecond LASIK is one of the most recent advances in the field of LASIK surgery. In this, a laser itself is used to create a flap in the LASIK surgery. Normally in LASIK surgery there are two steps. One is to make a corneal flap, the other is to do the laser ablation. The normal LASIK, a microscopic blade which is called as a microkeratome, it is used to create the flap. Whereas in femto-LASIK we can use the laser itself to create the flap. The advantages are: one, there is no use of any sharp cutting instruments like a microblade. Second, it is very precise, because the exact flap size, flap orientation, flap thickness, everything is preset on the computer, and the laser just does it at those settings. And third, it is very safe, because there is no risk of actual cutting that is happening in the eye. And last of all, the comfort level to the patient is very high, because he does not experience any kind of cutting force or cutting pain. It is totally painless, as it is a bladeless procedure. So these are the benefits of having a femtosecond LASIK.
For those patients with keratoconus where we cannot do LASIK, what are the other options available?
Yeah, now since you brought up this topic of keratoconus, it is now very commonly heard word. Keratoconus, let me just tell you what it is. It is just the progressive bulging of the cornea that happens in some people who have got very thin corneas. And because the cornea is thin and because it is progressively bulging, these people have very high powers and also irregular powers. And these powers cannot be corrected using a LASIK laser. The first thing to be done in these patients is to stabilize the cornea and to arrest the progressive bulging, for which there is a procedure which is called as collagen cross linkage. And this procedure that we do here, it's not a surgery in the strict sense. It is an outpatient procedure where riboflavin drops are applied on the cornea, and ultraviolet light is exposed, the cornea is exposed to ultraviolet light. So this helps to stabilize the cornea and to prevent it from bulging any further. So once the bulge has been arrested, then we can go for a procedure called INTACs or intracorneal segments, where semicircular segments, which are made of a material called PMMA. It is implanted into the cornea so that the bulge is reduced and the irregularity is stabilized and the patient's vision becomes better. So to just summarize, people who have got thinning and progressive bulging of the cornea, which is called as keratoconus, the first thing is to stabilize the bulge, to strengthen the cornea by the procedure called collagen cross linkage, after which we can go for the INTACs procedure so that the patient's vision becomes better and lesser dependent on glasses.
With this INTACs procedure, will the power be maintained throughout or will it have to be removed later on?
Generally, the INTACs procedure is a permanent procedure, and once done, along with the combination of collagen cross linkage, the bulge gets arrested and the patient's vision is stabilized. But there could be the rare case where there is still progression of the keratoconus. If that happens, then we have to go for the next procedure, which is called as the DALK, where just a layer of the patient's cornea is removed, and from a donated eye, some layers from that eye are removed and it is placed on to this patient's cornea. Thereby we increase the thickness of the cornea. So that is just like, to give an example, like retreading the old tires, which was done in the olden days, retreading the tires which are worn out. So similarly, the thin cornea we can stabilize by adding on some layers from the donated eye, which is called as a DALK.
Hope you had a good interactive time with Dr. Shibu Varki. You can subscribe to us and contact our customer care for further details.